Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, thank you. How you doing, Robin? You doing good?
I'm doing
How's
great.
your level of anxiety?
Sometimes it gets real high.
Sometimes it can tell you, because why? We do a radio show? Does that help? Does it help with the anxiety?
Yes, it does. The radio show helps bring me back down again.
How about, like, from your boss? Does your boss ever create any anxiety for you, ever? I'm just teasing. Dr. Robert T. London is on the phone. He's a psychiatrist, Joe.
He's great.
You don't want me to talk to this?
He's also a teacher. He's the founder of the short-term psychotherapy unit at New York University Langone Medical Center. I don't know if I said Langone right or not. He's a national pioneer in consumer health care, radio and television programming. There you go. Okay. Now we know. He's a writer and contributed to the Psychiatrist's Toolbox, which is a monthly column in Clinical Psychiatry News. And his book is called Find Freedom Fast, Short-Term Therapy That Works. Say Goodbye to Anxiety, Phobias, PTSD, and Insomnia. Dr. Robert London, it's an honor to have you on our show. Good morning, sir.
Oh, thank you very much for having me. Appreciate your introduction.
Are you at NYU right now?
No, I'm not.
Okay.
No, I'm not.
Where are you?
I'm sitting at home at my desk.
And where's home?
Home is in New York City.
Oh, okay.
I'm sitting at my desk. I'm paying some bills and getting ready to pay more bills in a little while.
So does the book give us the tools we need to overcome these things, anxiety, phobias, even PTSD? That seems like something we need professional help for.
Well, the book basically is a story of how I became a psychiatrist. It defines the anxiety, the phobias, the PTSD. We talk a little bit about insomnia. And it tries to give a composite of some stories of how people have overcome some of the problems. My commitment from the very beginning of my career was short-term treatment strategies. The idea is to find a way to circumscribe the problem and just treat the specific problem without the long-term beginning, a very long middle of talk therapy, and sometimes no end. And my father was a surgeon, and after World War II, he went back to Columbia University, New York Presbyterian, and became an eye surgeon. And when I went into psychiatry, his great advice to me, which I carried through my whole career, was learn something the other folks don't do. Because there was long hospital stays, and there was this open-ended talk therapy. The open-ended talk therapy many times still goes on. Mm-hmm. So I developed a short-term psychotherapy unit at NYU Bellevue in New York City. We started with smoking control and weight control, and then we branched into anxiety and phobias and some PTSD before it was even officially named. And it was very, very successful. And the idea was to take a medical model and apply it. You know, if you have a sore shoulder, you try and fix the shoulder, you don't work on the toenails. And the long-term care sometimes goes on and on and on. You know, suddenly you're unhappy because it's a rainy day while you're in therapy, and you spend 4 weeks talking about why you're unhappy on rainy days when you've come in for a specific problem, like say you're afraid of dogs, or say you just get anxious in crowds or something of that sort. It's basically, I developed the Learning, Philosophizing, Action Technique, LPA, and it's my spin on what's very popular today, cognitive behavior therapy, CBT. And the reason I like the learning, philosophizing, and action is that it's simple. People can understand how they learn. They can philosophize how it affected their lives. And a plan can be developed, an action plan, to get a new perspective on the old set of problems. And that's the whole thing about talk therapy, getting a new perspective on the old set of problems. I knew this guy who was terrified of dogs. And when he walked down the street, he saw a dog coming. He'd cross the street. His heart would beat. He'd start to sweat. He hardly could swallow. All these symptoms of serious anxiety coupled to a phobic reaction. And he came in. We talked a little bit, and I found out from him, this is learning, that he grew up with his mother and his grandmother, and they both disliked dogs. Okay, that's okay. You're allowed to dislike dogs. That's okay. However, as it translated into his thinking, it became a severe phobia as well as serious anxiety. And he wasn't coping very well because lots of people have dogs, and you've got to go walk down the street, and you go to work.
Right.
He had a setup to visit a college friend he hadn't seen in 10 years, and he had to travel about 1,000 miles, and he was really looking forward to it. And suddenly he finds out his college friend has a dog. And he's in this terrible bind, and then, of course, I end up seeing him. And I have this history about how the family didn't like dogs, and we talk about it. So we see how he learned this problem. And what we did was had him go buy a very, very good dog book, and together we looked at some of the photos. It made him very anxious, and over a week or 10 days using the book at home, he was desensitized and was able to turn the pages and look at all these dogs. The next step was for him to find a trusted friend who had a dog. And with that trusted friend in real life, he would have the friend hold the dog on a leash and never allowing the dog to walk towards him. That's a key thing. And he would, over a period of a few weeks, on different days in the week, walk towards the dog until finally he could get closer and closer and pat the dog. And this worked very successfully. Of course, he was super motivated. He wasn't going to yes but me or yes but the system. And it worked out to be extremely successful.
So
it was...
He really wanted to be cured of that, and that was part of the reason why he was successful, right?
You bet. You're right on, spot on. He wanted, and that's what I mean. Basically, motivation to get something done in life is incredibly important, and as well as having that motivation in healthcare. And we do this most of the time with all general medical problems, and the treatments are very circumscribed. You have this particular problem, we treat it. In mental health, I think the important thing is to be able to use short-term therapy first. And I don't believe it's used or taught enough for us to start with that. And then, of course, if you need long-term care, that's just fine. If you need some kind of medication management, psychopharmacology, that's fine. There are certain issues in mental health and psychiatry, psychology, that do need medication. And it's life-saving.
Yeah, I want to get to that as well, the medication part of it. But let's stick with the talk therapy just for a second. And I wanted to ask, let's change the dog for relationship. Let's say a lady, let's just come up with a little fake story here. Let's say there's a woman, and all of her life she witnessed her mom and dad in a horrible marriage. So by the time she comes of age and she's attracted to men, she just doesn't want that relationship. She's afraid of it. Just like this other guy was afraid of a dog. How do you use that same therapy to get her? We're assuming in my story that she knows this is a problem for her and wants to be done with it. How do you take her down that road?
Well, that's a personality situation as opposed to anxiety or phobias. And she grew up, I mean, you're talking about a different concept.
It's not the same thing.
But basically, your point is, again, well made. She's not getting what she wants, okay? And she, as you described this hypothetical situation, she's basically learned that these relationships don't work because she saw that in her own family. And now, unwittingly, because I don't believe you think about this, but unwittingly, her model, as I would see it for the moment, unless she tells me something differently, that she's now not having these relationships work. And I think if you took her back to what she learned and how it's affected her life, kept her away from what her goal is, what would be the next action? Because if I had to project this into the future, I would say I'm guessing, of course, this is hypothetical, I would say that when she does get a relationship, it usually doesn't work. And it doesn't work because that's the system. And then we kind of thoughtfully, and this is where cognitive therapy or my learning, philosophizing, and action therapy works. It's not how did you feel about this, what did it remind you of, and it's not going down that road. It's that what could be going on
Okay.
in your situation that what you want, you're actually running away from.
You have amazing stories from individuals and how you've managed to give them different therapies. One of the ones that I found intriguing was the PTSD, where you were talking about the split screen. I had never heard of that before.
Well, the split screen is one of my favorites. As I said, after my training at NYU Bellevue, I had a great mentor up at New York Presbyterian Columbia, Dr. Herbert Spiegel, and he taught me a lot about behavior modification and hypnosis, relaxation. Some of that is called mindfulness today. And I spent about 4 or 5 years with him, and that's when I took the program with my spin on it to NYU. And one of the great models is teaching someone, and you can do this in 5 or 10 minutes, how to relax and get into a very nice, relaxed state. And then imagine a great big movie screen. And you can put a thick line down that screen, and you could actually, in a controlled setting, project your worries, your fears, and anxieties on the left side of the screen. And you can see them without experiencing them. In other words, this could take an hour and a quarter, and you can shift someone to the right side of the screen and allow them to float into any pleasant experience they wish. It's been shown way back in the 40s by some great thoughtful psychiatrists that anxiety is incompatible with pleasantness. So basically, usually the pleasantness that you're seeing on the right side of the screen overwhelms the left side of the anxiety. Then, of course, you teach the person you're working with how to do this by taking a private island of time to themselves, that kind of thought, where they sit down or lie down, could be for 30 seconds, could be for 5 minutes, and they practice this split screen with the anxiety that they're concerned about that's dominating their life, and the pleasantness on the right screen. They may just want to modify this in their way, and that's part of the treatment, that you let someone modify it. They may just want to use a great big screen just for something pleasant. And it's a tremendous way of helping someone for a lifetime control their anxiety. And the short-term therapy approach it's trying to also, on a social level, take the stigma out of psychiatric care. There are many people who would get the help if they didn't think it went on forever.
Yeah. Absolutely true. Yeah. By the way, that private island of whatever you said, of silence?
Time. Private island of time.
Oh, I discovered this for myself in an interesting way. I wanted to share this with you. When you said that, I knew right away what you meant. I guess in general, I'm always doing something and always a little bit anxious because I'm always wanting to know what's the next thing and that kind of thing. I one time had to have all 4 tires on my car changed. And so I went to the tire store and was told it's going to be, whatever time, 2 hours, whatever. And so I sat in this little room with this bad coffee and a bunch of magazines and a TV that hardly worked, okay? And there was nobody else in there. And I sat there and I realized, wow, this is peaceful. This is nice. It wasn't the coffee, it wasn't the TV, it wasn't the magazines that were already old. It was just sitting someplace with nothing to do. And no expectations on my own of myself to do anything.
Well, you're making a very rich, terrific point, because obviously in the societies most of us live in, the stress levels are very high, and even if you haven't inherited your anxiety or inherited your stress or had experiences that cause anxiety, we don't have that time to do just what you did. And some people don't do what you did. There are folks who have situations, difficulties, and on their own they solve them. On their own they have the wisdom that you just demonstrated, a memory of being in a room for 2 hours and with nothing to do.
Right.
All the stress came out of you.
Yeah, the difficult part, I just want to stress, is doing that on purpose, because that was kind of, I had no control over it. So I've often thought to myself, how do I do that on my own? Do I just close the door and just not answer the phone? How do I do that?
Well, that's the point. In other words, you can learn to take a private island of time for yourself, and if you learn how to get into this relaxed state, which is most people can do it, and have a process like the screen. The screen is a great process to project everything that's bothering you or to see something extremely pleasant on that right side of the screen, and suddenly you're away from everything. And once you learn this, if you practice it 3 times, 6 times, 10 times, it becomes as easy as signing your name. And you just take this time, and if you're good at it, which most people will be, you're doing it for a minute. If you have lots of extra time, you can try it for 10 minutes. But it's trying to get something out of you so your whole body feels better. Obviously, when we're relaxed and less tense, I think we're basically much healthier.
I want to go in the direction of the pharmaceutical solutions to some of the psychiatric problems, and I'm going to use Bruce Springsteen as my way to take us there, because I was in his biography or autobiography, he talks about getting so depressed, and maybe early in his life, but he was talking about recently, like in the past 5 or 6 years, that his wife noticed something was up, and she was smart enough to know he needed a psychiatrist. Long story short, he swears up and down that whatever medicine the doctor gave him does make a difference, and when he forgets to take it, he can tell. I always was under the belief that we could get through anything with talk, but after hearing, because I was listening to the audiobook, that's why I say hearing, after hearing him talk about that in his book, I changed my mind. I thought, well, maybe the medicine does serve a purpose, and I'm kind of, because I do a radio show, what do I know about psychiatric medicine? Can you talk about that?
No, I think you do know. I think you know more than you're letting on. There's a place for medications in the late 40s and 50s and 60s and 70s. Starting, of course, in the 50s, we have developed great medications to treat high blood pressure, to treat heart disease, and to treat mental problems. And the breakthroughs have been life-saving. And I'm talking about anxiety and phobias and some aspects of PTSD, which can be treated without medications. But there are some disorders, mood disorders, depressions, the schizophrenias, that do very well with medication. And therefore, there's no problem having medication. Obviously, if you have pneumonia or a bad infection, or if your blood pressure is much too high, the medications are going to help you, and not only help you, in the long run, be life-saving. The same thing with mental health. And if this man, Bruce Springsteen, had a depression that responded to one of the medications, and it works, that's all you should be concerned about. The biggest picture is, I think, for the thousands of people that I've seen over the years, there's an awful lot of excess medication going on, where there's too much mixing and matching with medicines. And if 1 or 2 medicines don't work, we try a third. And sometimes one forgets to take away the first 2 that aren't working. Even if the third starts working, you may still be taking the first 2 that have shown they don't work, and suddenly someone is on too much medication. And sometimes medications are being used just for the side effect profile, very strong, powerful medications, because they may make you sleepy, and they're good to help you fall asleep. That kind of stuff doesn't sit too well with me. But medications work, and we should be for them when they help someone function better and live better.
Right.
But
I'm okay with that.
But your insight into helping others really manifested itself, I think, into your insight of helping yourself during Hurricane Sandy.
Oh yeah, well, it certainly. What a great point. That was so many years ago, and I was able to experience. I was right in it, and I was watching the hospital get evacuated. And I thought I'd be fine because everything works so fabulously in New York City. Not the traffic, but the electricity stays on. The electricity stays on. The water runs, and suddenly there was a flood and knocked out the power station in the whole southern part of Manhattan. And figuring, well, my heavens, in 10 or 15 minutes it'll be back on. This is New York City. And one day went by, and 2 days went by, and I wasn't paying attention to filling the bathtub with water, a lot of things. And the food runs out, the refrigerator, the stuff goes bad in the refrigerator. And it started to bring up a huge amount of anxiety, as it did for thousands and thousands of people.
Yeah.
Because if you're in a high-rise building, and so many of us live in high-rises, the elevators aren't working, the power's not working, the extra lighting in the stairwells goes out, and it can be very, very anxiety-provoking. It was for me. Luckily, my phone was working just fine, and one of my sons said, "Hey, I'll come on and pick you up, and we'll go out to my place," which worked out just fine. However, I nearly broke my head open going down the dark stairway.
Oh my gosh, really?
Because I'm carrying a little suitcase and I'm holding a flashlight.
Wow.
And it's dark. And
what floor do you live on? What floor do you live on?
I'm up away on the 14th floor, so it was a little bit complicated.
Yeah.
So. And walking up would have been very difficult because I'm not accustomed to walking up 14 flights as a rule.
Sure, yeah.
But that also evoked a lot of memories for you.
Well, it just shows me, it shows what can happen to people in terms of stressful situations. And sometimes it gets better. You can bend over and hurt your back, and it gets better, and that's just fine. And you can bend over and hurt your back, and you need help to get it better. And the same thing for emotional problems. I think the medical model really works. All people are very different, and some people tough it out, and they work it out on their own, or they get some pastoral counseling, or through education, and other people need the help, and I certainly think that the short-term model should be what we start with, and I believe that more therapists in all disciplines should be approaching that. I will also add, I think it's important for someone to be a very good consumer, and to be able to ask someone on an equal plane, what procedure are you going to use, without being in denial or resisting or challenging the therapist. It's not so bad. We ask in a store if the meat we're buying at the deli counter is fresh. What kind of therapy are you using? We want to do that same thing.
I love that.
Wow.
Dr. Robert London is our guest. His book is called Find Freedom Fast. It's a 3-step program to say goodbye to anxiety, phobias, PTSD, and insomnia. Real quickly, before we run out of time, so far we've pretty much talked to or about the people going through these things. Talk to the loved one, the person who's concerned because his wife is always nervous or her husband is. Talk to the person who's the loved one of the person that needs the help.
Well, I think support is a very important thing, and encouragement to get help. But your point is excellent in the sense that an emotional problem can, in a sense, be contagious to the whole family system. It's not contagious like a bacteria or a virus, but it can, as an umbrella, it can affect the entire family. So oftentimes, if someone has a serious mental, emotional problem, the family is affected, and they can get depressed. They can also get anxious. They can get extremely frustrated if a person is not getting the help. So that particular person needs support. And sometimes, even in a short-term therapy, a family approach is very important, because a family approach is as close as you can get to making a house call. And oftentimes, people come in, and for 5 or 6 minutes, everyone's perfect. And then everyone forgets that they're in a setting that's therapeutic, and all the issues come up, and you can be of great help in that family setting. So that's an important concept to always bear in mind, that when you're treating someone, sometimes you got to bring other people in to get a bigger and better picture. I learned a long time ago, and this is not always true, but it's an interesting concept. Someone said to me, "What's the most important thing in a emergency room? What are the 3 most important things?" Well, no one can really answer that. And the answer was collaterals, collaterals, and collaterals.
Oh, okay. The other people, yeah.
Yeah, and it's so very important, because sometimes in an emergency situation, in all fields of medicine, including psychiatry and psychology, you can't get those collaterals. Someone doesn't give you the information, or they're, not in a stable environment. But there's obviously a lot of medical information you need. But that kind of concept of collaterals, and collaterals is so helpful when you have to treat somebody. So the family concept is real important.
I have a copy of the book. If I have a listener who would like it, give me a call right now, 622-9622. I will pick one caller at random, and you can have this. It's called Find Freedom Fast. If you want to buy it, you can find it on Amazon, which is where I found it. And I was wondering if you have a website you'd like to recommend.
There's a findfreedomfast.com that also talks about the book and gives an outline about the book, and you can purchase it through that system.
Okay, very good.
So it's findfreedomfast.com.
Dr. Robert London, thank you for being on the show with us, and you've given us some good information. Thank you.
Thank you for your time.
You're welcome. We'll be right back.
Okay, right.
First Church of Christ Scientists will be providing another inspiring lecture at 2 p.m. on March 30th at the Weber Center, located on the campus of the College of Central Florida. Jose de Dios Meta will be the guest lecturer, and he will also be our guest on Friday the 29th to give us an overview of his lecture, The Power of God's Divine Love,